Hello, my name is Diana Hughes. I am a grad student at the University of Mississippi in the program of Early Childhood Education, and I am going to present a topic paper for the Child Development class on socio-emotional impact of COVID-19 on young children. Okay. Traces of COVID-19 began to surface the United States in early January of 2019. By January 13th, World Health Organization, which we will identify later as WHO, proclaimed a global health emergency. 3 days later, February 3rd, the Trump administration announced public health emergency. By March the 11th, WHO announced the COVID-19 pandemic. And now, 2 years later, we're still struggling. Not so much as with the spread of it, but with the impact of the COVID-19. There has been and is still continue to be a lot of focused research on the medical and physical health impacts on adults and children. But there has not been a lot of research on the impact of social development of children under the age of 5. Fortunately, researchers have begun to spend a little more time on this subject, and researchers and educators are becoming more aware of the impacts of this pandemic on children and have begun to spend more time studying it and making efforts of closing the gap between learning and social development of children. Now, social emotional development is concerned with how children think, how they feel, and how they act. The 5 social and emotional learning competencies are self-awareness, self-management, social awareness, relationship skills, and responsible decision making. Each of these competencies are addressed by a qualified early childhood educator. It is our duty and our pleasure to make sure that each child that we care for accomplishes each of these competencies. Unfortunately, because of the pandemic, many children lost that opportunity to get the development that they need because they were unable to attend an early childhood program that could help them to develop these competencies. Okay. And here you have it, an early childhood educator in action. Nurturing, protecting, and providing a safe and routine environment full of fun and learning. And now back our focus. According to pediatric physicians at a family clinic in Los Angeles, California, the pandemic's closing and social distancing measures caused children not to get the cognitive and social stimulation that they would normally get outside of their homes. And they were able to note that there were several delays in speech and language, as well as trouble sharing and being in groups. One physician even noted that there became a struggle with teaching children to share during the pandemic because of the lack of social interaction, that children were being taught not to touch things that someone else had touched. Okay, and that makes it very hard to teach children to share and also to work as a team, especially if you are not touching what other people are touching and you're not being together because you have to be socially distanced. According to Rashmita Mistry, the author of a recent study of how the pandemic is likely to affect children's health and well-being, noted that children of lower income families lost the opportunity for vital benefits that aided in their cognitive development, their mastery of basic foundational skills, as well as their crucial social emotional learning that typically occurred in an early childhood childcare setting. during the pandemic. And because due to multiple reasons, they were not able to attend, whether it was because they couldn't afford to, or because the parent lost a job, or what have you. There were several different reasons why. And Mystery warns that lower income children will continue to struggle in areas of cognitive, academic, social, and emotional development if there are no points in the system to catch and correct the child's loss during the pandemic. Another resource by the name of Zach Vander Graaf. He is a music specialist, and he states that the biggest problem is that the children have been cut off from resources that they previously relied on for helping to cope and seeking protection over the last year and a half. And he stated how these students, they were glad to come back to be talking with their friends and seeing their friends again, but it didn't take much to send them off spiraling down and displaying the disruptive behavior. And Vandergriff, he believes that this behavior is a result of the trauma caused by a lack of formative social involvement that typically transpires in preschool and kindergarten. So this is happening in first and second graders. However, Vandergraaf is not the only one that cites trauma as a problem. The National Center for Chronic Disease Prevention also cites that trauma of the disarranged routines and the loss of regular caretakers and social distance requirements as negative effects of the pandemic on social development of young children. The CDC also suggests that the fact that the kids were missing birthdays and birthday celebrations and other family celebrations due to social distance and stay home mandates says that they contributed a lot to the social development of young children. So much so that they made recommendations to minimize the impact of the pandemic on young children. They recommended that reading books about emotions to help them understand expressions of emotions, along with creating new and different ways to celebrate those life events that they were missing. Also, they began to encourage parents to offer their children positive coping through play and talking about emotions, and instructed them to take advantage of current technology to communicate with family and friends via phone and or video chats, or maybe Skyping, or perhaps even writing them cards or letters to family members that they weren't unable to physically see. So they actually jumped on the bandwagon of what early childhood educators have been pushing all along. Okay, there are four broad factors to protect against maladjustments. And when I say maladjustments, I am talking about the negative impacts of the pandemic on children. One being the child's personal characteristics, two, a warm parental relationship, three, an adult outside the immediate family who offers a supportive system, and four, community resources. Of course, all of these were not able to be used during the pandemic due to social distance requirements, but that does not pose a problem because the textbook tells us that a child usually only uses one or maybe a couple to perfect resiliency. Another recommendation by the textbook was the 4 R's, which was reading, writing, respect, and resolution. It is a resource used in schools to promote healthy social and emotional skills. And the program covers anger management, responding with empathy, being assertive, resolving social conflicts, and standing up against prejudice and bullying. I would like to conclude with just a couple of recommendations for parents. Number one, that they will role model what calm emotional strength is and offer security to their children, and also listen and discuss traumatic experiences with their children. One psychologist also recommended to take advantage of family time, eat dinner together, may have a movie night, talk about togetherness, help the children learn to master and challenge and manage stress, and become good stress managers and practice resiliency. I hope you were able to get something out of this discussion.